Welcome to part 2 of the Workforce Wellness in Times of Uncertainty webinar. This webinar is presented by the Trauma-Informed Communities Project, a collaboration between the Center for Child and Family Health and the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. We're glad that you decided to join us again and hope that you find this information helpful as you develop trauma-informed practices to support your community during COVID-19. This webinar is presented in 2 parts by myself, Danielle Mears-Harrell, and project faculty Pam Price, Sarah Skinner, Angela Tuno, and Caitlin Donish. Terry Grant, State System of Care Coordinator at the Division of Mental Health, and Felicia Gibson, faculty at the Center for Child and Family Health, have also contributed to this effort. Part 1 of this series delved into the impact of working with children and families exposed to trauma. In Part 2, we will focus on identifying individual and interpersonal wellness strategies to support radical healing and health. We are approaching wellness from 3 different levels: individual, interpersonal, and organizational. Pam and Sarah addressed individual wellness strategies in Part 1. Now, Angela and Caitlin will discuss specific strategies for supporting interpersonal wellness. You can look forward to learning more about organizational wellness in a future webinar.
Hi, my name is Dr. Angela Tuno, and I am thrilled to be with you here today. I have been honored to be a part of the Trauma-Informed Communities Project from the ground up, from the very beginning. And I know that I will know some of you who are watching, so it's good to see you again. Thank you again for welcoming us into your communities. It's been a privilege to work with all of you. So you all have heard from Pam and from Sarah about building recognition of the workplace hazard of secondary traumatic stress, compassion, fatigue, burnout. And now we're going to talk a little bit about individual and interpersonal wellness strategies. And there's a reason why we say both, because self-care, focusing on just the individual, is not sufficient. So we don't want self-care to be one more thing we feel guilty about not doing. We want to move towards healing. We want to move towards healing ourselves, towards healing within our community, within our organization, and open ourselves up to more than a traditional framework of healing, to include what we know about collective approaches to heal ourselves, our organizations, and our community. And part of that is considering how healing can also be experienced within a community setting, that maybe it's not just on the self. We need to look at our organizations, our agencies, our communities as a place where healing can happen. Part of that can be honoring the community. And that is something that Caitlin Donish will be talking about here in a second, through things like ancestral wisdom, learning from those who came before us, learning what they know, sharing within their wisdoms, their stories, their spoken word, being able to learn from that. And organizational wellness strategies. So promoting this culture of wellness that is not just on the worker, it's not just on the worker to take care of themselves, is on the agency, on the organization, on the community, to make a place where wellness is a priority, is part of the culture, is part of the everyday, and promote hope, strength, and resistance. We're going to use this framework when we're focusing on wellness. Some of you have seen it before. It makes it super simple, although we know it's not that simple. It's easy because it has the ABCs in it, right? Awareness, balance, connection. Easy to remember. ABC, awareness, balance, and connection. And we're going to start with focusing on awareness. And I'd like to introduce to you all this concept of radical healing. So this concept of radical healing was introduced by French and colleagues in their 2020 article. And you'll see the citation here at the bottom. You're going to get a reference slide at the very end. I highly recommend you go and look at their framework of radical healing. I like to think of it, I was trying to think of a way to illustrate it in an easy way. And I mean, it's not easy, but I want you to think about the last time you were on a seesaw. Now, maybe some of you do this daily, but I don't. It's been a while. But if you think about the last time you were on a seesaw and there's opposite ends, you know, when one side is way down, the other side goes up, and vice versa. And it's really hard to find that balance or equal weight right there in the middle. Now, when we're thinking of radical healing and thinking of the current times that we're in, Opposite ends of the seesaw, opposite ends of the spectrum. On one side, we have the despair of oppression, this hopelessness. On the other side, we have the imagination of possibilities, which sounds really good, right? But also can have a detrimental effect of separating ourselves from reality. If we're too caught up in the imagination of possibilities or too blindly optimistic, too far on that side, it's not a bad thing to be hopeful, but if we're too far on that side, it can result in a lack of action, separating ourselves from reality. So on the left side, let's say we're weighted down in this imagination of possibilities. And you can see if we're too far on that end, it can result in this lack of action by distancing ourselves from what currently is going on. Now, on the other hand, if we're weighed down on that despair of oppression, we're weighed down in hopelessness, in feeling like everything's hopeless, there's no point, it also results in the lack of action. So both very different experiences, very similar results. That if we find ourselves on either ends of the spectrum, it can result in this lack of action. So the concept of radical healing is, how can you find this balance? How can we hold these two opposites to be true at the same time? Also known as a dialectic, for those of you who are familiar with dialectics. So can we acknowledge this oppression? Can we acknowledge the despair of the oppression, the sometimes feelings of hopelessness, and still move towards healing and freedom? And how do we maintain that balance? And we're going to talk about that more here in a second. I want you to reflect on where you are on the seesaw. Now, for me, it can go in multiple directions, multiple times a day, depending on what I'm doing. I can find myself in that despair of oppression quite often, depending on what news I just saw or what story I just heard, or the day that I've had at work, and really trying to pull myself towards healing and freedom and imagining possibilities. If I find myself too far on that end, then that separates me from what's really happening. So really finding yourself here in the middle. So with awareness comes power and choice. It's easy to go about our day-to-day and not check in with ourselves. We have multiple tasks, multiple demands, and it's important to feel our feelings. Because as we feel those feelings, we have awareness, the A and the ABCs, and that comes with power and choice. So first, checking in with yourself to notice thoughts and feelings as they arise. When we become aware earlier, we can get ahead of getting hijacked by stress and connect with coping that works for us. Now, what that is may be different for different people. And again, self-care, there's no judgment. You do what works for you. And noticing it as it arises, noticing this distress as it arises, is one way to tackle it ahead of time before we get hijacked by it. It's okay to notice increased distress. Of course, we're going to notice increased distress. We have a surge in care demands. You know, I'm hearing more and more about the mental health pandemic, right? I'm hearing those words more. And I know for those of you watching this, you work in agencies and service systems that have this surge. You felt this surge. I felt this surge. It's okay to say that. We also have the risk of infection, right? We also are dealing with the same things that we're helping others cope with. Caregiving demands as well. So we may be taking care of children and balancing that while working, and maybe taking care of elderly parents and balancing that while working. We're living in a time of social injustice, recognizing, acknowledging that, working towards finding that balance of acknowledgement, and moving towards hope and action, amongst other stressors, right? And so that's personal for each one of us, but I want you to think about that increased distress. Now, noticing these thoughts and feelings related to distress does not indicate weakness or inability to do your job. And I think that's a bad reputation of self-care, of that if you can't hack it, then maybe you shouldn't be made to do this work. Absolutely false. Absolutely false. And we've talked about this work. We have to acknowledge that secondary traumatic stress, compassion fatigue, stressors, burnout, that's all part of the workplace hazards. And part of talking about it is part of building awareness. Building awareness also gives you some knowledge of when it's time to shift. So knowing those cues, right? For me, it's in my jaw and my neck. When I start feeling that tension, I'm like, okay, let me check in with myself. Maybe I need to take a break. Maybe I need to get outside. Have I been outside? Especially these days, right? Let me get some sunshine. So I think this awareness is critical as a first step. I want you to look at these two quotes. I love these two quotes. So are you noticing negative thoughts or feelings? Sure, that makes complete sense. So Dr. Barbara Fredrickson, the negative screams at you, but the positive only whispers. And Dr. Rick Hansen, similarly, positive is like Teflon, doesn't stick. And negative is like Velcro, it sticks easily. Gosh, those two quotes really sit with me and make me think of, especially the negative screams, the positive whispers. How true is that? Right? And we're definitely facing a lot of negative these days. And those are the things that stick, and really having to listen for, to look for the whispers of the positive. And we'll talk about that here in a second. We can sometimes find ourselves swimming in the negative or the negativity bias. There's a reason for that. It makes complete sense. Humans are hardwired to register these negative events more quickly and clearly than positive events. So why do you think that is? You know, if we go back and think evolutionarily and look at our survival instincts as human beings, as animals, we needed to be on high alert for negativity or for danger to be able to survive. It was a good thing to notice the negative, right? That's a threat. That's a threat. I'm going to stay away from that. And we have to quickly notice those negative things, quickly notice those threats. And what that means is we notice the negativity easier than the positive. The good news is that we can fight this instinct. We can purposely focus on the positive and train our brains to notice those positive things. Caitlin's going to talk here in a second about gratitude and the research behind that. So really being able to train our brains, we have this opportunity to notice those positive things. Some days are easier than others, sometimes easier than others. So being compassionate with ourselves and patient with ourselves as well. You know, some research says that we have to focus on the positive event for 20 to 30 seconds for it to register, where those negative events, they register almost instantaneously. So really being able to say, I'm going to sit here and focus on the things that bring me positivity, even in the moment. So if I'm enjoying a good piece of candy or a nice drink that I like, if that's a Coke Zero, coffee, whatever, insert whatever you enjoy, but focusing in on, oh man, this is really good, or I really have enjoyed this moment with myself. Okay. There's also the concept of radical hope. I want you to remember the seesaw when I'm talking about radical hope, the seesaw of radical healing. Hope is needed to notice the struggle is real and not in vain. So hope is a belief that we have agency to change things for the better. And I want you to look at this picture on the side because it makes sense here. So finding that hope in an environment of darkness, of an environment of hopelessness, finding that hope that if we're weighed down on the seesaw of despair, of oppression and hopelessness, that radical hope can pull us more to that centered balance. It occurs when we don't know what the future holds, but we believe, we know good things will and can happen. And I'm preaching to a room, to a Zoom room full of people who I think understand this concept, this radical hope concept of we believe change can happen and change for the good. And really for radical hope, it's a commitment to strength and resistance. Now this comes from what we have learned, the ancestral wisdom from BIPOC communities, from Black communities, about being able to find that light, those joys in environments that are dark, and being able to engage in radical hope. Part of that is investing time for yourself and connection to one's community. Now, what that community looks like is different for every person, but finding your community where you find that radical hope, where you find those shared experiences, and being able to find that investment of time and energy and care to run the marathon, to commit to strength and resistance, to find your balance on the seesaw. Some other ways to find the positive. In the midst of a crisis, it can be challenging to find goodness when we're surrounded with fear and uncertainty. So let's say we're way down in the despair. We're way down in the despair of oppression and hopelessness. How can we pull ourselves more to that balanced seesaw? One thing, choose your company wisely. We all have people that bring good, positive energy to us, and we also have people where we feel drained after talking to them. Notice who those folks are. Find more time to commit to people who bring out the best, most effective versions of ourselves. Limit and monitor media exposure. So make sure we have a commitment to limit the news. The news is heavy, the news is hard. When we first started in March, was it March? In March, where the pandemic first started, was thinking about, when that social distancing first started, that I had the news up all the time while I was working, and I was drained. I've since changed to watching 30 minutes of the news at the end of my day. 6:30 p.m., I watch the news, and that's it. That's all I allow myself to do, and it's helped immensely. Also, finding those moments of gratitude. I talked about this before, of noticing those moments purposely. Remember, we have to purposely focus, sometimes 20 to 30 seconds, on things that we're grateful for, on things that we feel positive when we think about. Here's another resource. Sarah talked about the impact on Black communities. Being on the internet right now is not psychologically safe. Same thing with the media. So looking at what self-care when the news is difficult. And here are some steps. And I have the link here if you all want to go look more into this Instagram. So unplug and filter, take a break from the news, feel your feelings. When something tragic happens, it's normal to have a variety of feelings. It could be sadness. It could show up in anger, in snippiness, in confusion, in lack of concentration. All of these are okay and valid. There is no one way to feel about these things. So you can be feeling a lot. Don't exhaust your energy trying to make sense of how you feel. So that's judging ourselves for, why am I feeling this? Or why did I just get snippy with this person? They didn't do anything to me. Feel your feelings, it's okay. Get support. Make plans to spend time with loved ones who are supportive. Make an appointment with your therapist. Get onto an online community if you feel safe on an online community. Connect to your communities of care. That looks different for every person. Remember that grief is complicated. When we're watching these news stories, we may not directly know this person. We may relate to this person on a variety of levels. So thinking about that can be grief. That can be grief. And acknowledging that there is no one way to grieve. It makes sense and is completely normal to feel these things. Allow yourself to feel them and get support and be able to use your community and your own self-care strategies to move through.
Hi, everyone. My name is Dr. Caitlin Donish, and I'm so thrilled to be with you today. I'm going to pick up where Angela left off to talk a little bit more about strategies to focus on wellness. And I'm going to talk about balance and connection. When I think about balancing professional and personal responsibilities, this quote always comes to mind, and it's from Brianna Weiss. I'm going to walk you through it and then tell you a little bit about why I think it's so powerful. She says, true self-care is not about salt baths and chocolate cake. It is making the choice to build a life you don't regularly need to escape from. And that often takes doing the things you least want to do. It often means looking your failures and disappointments square in the eye and re-strategizing. It is not satiating your immediate desires. It is letting go. It is choosing new. It is disappointing some people. It is making sacrifices for others. It is living in a way that other people won't. So maybe you can live in a way that other people can't. And what I want you to take away from this is this recognition that self-care is so much more than salt baths, chocolate cake, a special latte. It is making some really difficult decisions in your life. And these decisions and this sort of movement towards balance is not static, it's not stagnant, and it's actually very aspirational. And given that our life and our responsibilities change all the time, the way that we balance those responsibilities or the things that we care about might look different depending on what day it is, month it is, or year it is. So when we think about finding balance during COVID-19, I really want you to think about where your needs are right now when looking at Maslow's hierarchy of needs. And you can see that at the bottom, we have basic needs. Through the middle, we have the psychological needs, and then finally self-fulfillment needs. So right now, in your life, I want you to think about where you are. Are you sort of at the physiological needs level where you're looking for food, water, warmth, as well as getting enough sleep? Are you in the safety level where you're seeking security and physical safety? This can also border on psychological safety. It could be having consistent employment as well as healthcare. Move to belongingness and love needs, right? Or do you have an intimate relationship that you feel safe and secure in? Do you have connection with friends or your larger community so that you can get some of that strength and trust from others? Or have you moved into esteem needs, prestige, feeling of accomplishment, recognition, or strength in yourself? Or are you at the self-actualization stage, right, or level where you're able to achieve your full potential, including creative activities, and you're becoming the self you want to be? And recognizing that we're all sort of shifting among these stages. It's not as though we're stuck in one stage or not, but recognizing that some of the families we work with and some of our colleagues might be experiencing food insecurity or financial insecurity. So they might be a little bit lower on this level, and they need some support to be able to feel safe and secure. Next, it's thinking about how do we solidify or how do we address those basic needs for ourselves? And we all know like the tenets of health, right? So we need sufficient sleep, need to be hydrated, drinking enough water, eating healthy foods that make us feel good, the next day, and then social connectedness. Now, even these 4 sort of tenets of health can be really kind of difficult to achieve. Sometimes it's hard to sleep and we have a lot going on and it's difficult to fall or stay asleep. Sometimes we forget to drink enough. So even if it's just, 4 extra ounces a day, 8 extra ounces a day, doing what we can, thinking about and not feeling guilty about the food that we eat, but recognizing how we can combat fatigue and feel better about what we're putting into our bodies, and knowing that sometimes we need a quick meal, right? Sometimes our family, we just need to get food on the table. And so giving ourselves some self-compassion and grace around food. And then how do we connect with others? And we'll be talking more about that in a bit. So as we move towards balance, I want to underscore this next point, that as we move towards it, right, this aspirational goal that is ever changing, it's recognizing and committing to the belief that you are worthy of care and healing right now, in this very moment, not when you check the next thing off your task list, not when you finish a big project, right now, right, with your long task list, feeling stressed. You are doing the best you can. And this has been a really helpful coping thought for me, that I'm doing the best I can, especially when amidst a couple of different pandemics. So when we think about 4 possible approaches to moving towards balance, I want you to think of the following. The first is self-compassion. And this is really honoring and accepting your humanness. So instead of judging yourself, criticizing yourself for what you perceive to be shortcomings or inadequacies or mistakes or errors, it's really recognizing that making mistakes or having a long to-do list is part of the human condition. We all experience this. You are not alone in that, right? And that actually committing to treating yourself with compassion and respect and grace, right, and flexibility is hard to do, right? But knowing that you are worthy of that compassion, just like everyone else. And so to do this is first taking care of your own needs. And I'm sure you've heard the adage or the sort of the story that, we need to put our own oxygen masks on first on a plane before we place them on anyone else, like children or those who need help. So this is the same here, especially during the COVID-19 pandemic, is taking care of your own needs before investing energy into helping or caring for others. Your pitcher needs to be full before you can pour it into someone's glass, right? And so as we think about taking care of your own needs, you have to approach this with some patience. Change is hard, right? Changing a behavior or a pattern of behavior can be incredibly difficult. And so how can you change a small part of your current routine to prioritize caring for your own needs, right? This doesn't mean that if you need to get more exercise or you want to get more exercise, you need to run a marathon. I'm going to give a specific example of something I've been working on. And at the very beginning of COVID, I was having a difficult time separating like my personal and professional life. And one of the ways that came out or manifested was that I struggled to take lunch. And I was warming up my lunch, walking upstairs and eating it in front of my laptop. And over time, I realized that I was so fatigued at the end of the day. I was exhausted and I needed to be able to integrate breaks into my schedule. So over the last few months, I've really been working towards taking a lunch break. Sometimes it's 15 minutes. Sometimes it's more like 45 minutes. Other days, I've unfortunately, booked myself back to back during lunchtime. And that's okay, right? I have compassion with myself that sometimes my schedule needs to be flexible, but I'm working towards more consistently taking that time, right? And finding that balance. When I notice that I'm on falling onto the hopelessness or frustrated side of the seesaw, what can I do to kind of equalize that seesaw? And for me, it's taking a step away from the laptop, but for you, it might look different. Other ways we can reduce stress in the present moment and beyond is through physiological grounding and cognitive and emotional reset. So by physiological grounding, I'm really talking about sort of bringing our awareness and our bodily awareness, into a reflective state, right? So we also call this neuroactivation resetting. A few ways that you can do this include deep breathing, and that's breathing from your diaphragm, right? So expanding kind of your belly as you take a deep breath in instead of breathing from your upper chest, right? And that's what kind of leads to hyperventilation when we become anxious. So really taking those big, deep diaphragmatic breaths. We also know that regulating exercise is really helpful. So this is the intent to deploy energy in constructive ways. Sometimes our stress response system needs a reset, and we can do that by deploying or sort of moving out quite a bit of energy through jumping jacks or running in place. And sometimes I even do as many push-ups as I possibly can do, and that helps reset my body. It ultimately enacts the parasympathetic nervous system, and it allows sort of the stress and that tension to move away from my body. Another thing you can do is something called a cognitive and emotional reset. Now, for those of you who practice mindfulness, this might feel a little bit different. This is more on the cognitive behavioral spectrum of things, but this is addressing the automatic thoughts that pop into your mind. If this works for you, that's great. If it doesn't, feel free to try something else. So when you have an automatic thought come into your mind and you didn't even know it was there, what you can do is ask yourself a few different questions. One is this thought true? Is it useful or necessary? And is it wrapped or does it come from a place of kindness and compassion? We're coming back to that self-compassion tenet. So an example might be a thought that pops into your mind, like everything is out of control, and you might want to replace that or think about replacing it with, there are many things that We don't know about the COVID-19 pandemic, or I don't know about the pandemic, and that is scary. There's uncertainty. It could be fear-inducing. And also recognizing that this won't be forever. And there are some things that we or I can control right now, right? I can wear a mask. I can use hand sanitizer. And if I feel overwhelmed, I can do some deep breathing to reset myself. These are some other ways that you can do that physiological grounding. And we call this the 5-4-3-2-1 activity. You can search it on YouTube and you can have someone walk you through it. But we also call it grounding with your 5 senses. So for example, you might say to yourself, okay, what are 5 things that I can see right now? And you would say, I see the sun through the window, I see a picture on the wall, and I see people walking on the sidewalk. Then you would name 4 things you feel. I feel the wind blowing on my face. I feel my feet on the floor. I feel the carpet between my toes. And I feel the pencil or a pen in my hand. 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Like I taste the mint I had after lunch. If you don't taste anything, you can just think about your favorite food or a flavor that you really love. If you don't have time to go through the full 5-4-3-2-1 activity, you can use other grounding strategies, right? Or awareness strategies, sucking on a mint, right? And enjoying that sensation, smelling a nice candle, listening to the birds chirping outside your window, or smelling freshly cut grass. Sometimes we do this without even knowing, like putting on a soft shirt or soft socks, wrapping a warm blanket around us. That's a way that we can kind of ground ourselves in our sensory environment. Something that I found to be really helpful in sort of managing my seesaw is creating a transition ritual. And so I want you to think about whether or not you found the boundaries of work and home to be blurred now more than ever. I know for me, I've had some difficulty sort of stopping my desire to do work at night. And so one way we can address this is to transition from a work mind to a home mind. And we can do this in a few different ways. One strategy is talking with your colleagues at the end of the day. You could take 3 minutes to connect with a colleague about what your day was like, what you got done, what you're hoping to do tomorrow. But I also want to underscore, try to set limits, right? So you don't overshare, especially if, you work in trauma or you're a therapist and you talk about trauma details, try not to slam anyone else, right? And just kind of stick to, the general tasks that you completed during the day and how you felt during those tasks. Another thing you could do is trying to turn off your work mind. This might be telling others what you need. If you share your living space with others, discuss what needs to shift from work to home or rest mode. That might be setting a regular dinner time. It might be going for a quick walk after work, or putting laptops away at the end of the day. You could have a transition ritual, which might mean changing out of your work clothes, like blue jeans or sweatpants, washing your face or hands, or going for a walk around the house, just to reset. And then finally, respecting your own time and having compassion for yourself if you need to maintain a flexible work schedule. So what do we mean by that? I mean that we all have various responsibilities right now, especially if you're homeschooling or you're caring for an elderly individual, or if you and your spouses have just difficult work schedules. Knowing that everyone's schedule looks different, right? This is again that element of self-compassion, knowing that your schedule might look different than your colleagues, and that's okay, right? Do what works best for you, and try to be as flexible as possible. This is one of my most favorite activities, and it's the last for creating balance in your life. And this comes from one of the fathers of positive psychology, Dr. Martin Seligman. And he developed the 3 good things exercise. I'm going to spare you the details of this, of the research that he's conducted with it. But in essence, what he did was he asked participants to write down 3 things that went well during their day and how they were involved in it. And participants did this for 1 week. And after 1 week and into the future, participants continued to have fewer depressive symptoms and felt happier than those who didn't engage in this exercise. So an example would be, I might think to myself or write down, dinner was better than usual tonight. I'm really grateful for dinner, but you know what? I remembered to pick up ribs from the store. That's how I was involved. Or I enjoyed watching a movie with the kids, right? And how I was involved is that I made an effort to schedule family time, right? Usually when schedules can be chaotic. So you can do this by writing it down, sharing it during dinner, or with a spouse before bed, whatever seems to make sense to you. So the last piece of our ABC model is connection. And connection is something that happens at different levels, right? It can happen at an interpersonal level between two people, within a community, within an organization, or even within a society. And so we start by building connections and supportive relationships, as it is one of the most powerful, right, and intense stress reducers. And this can be with coworkers, friends, family, and the community. One of the examples that I give is that during the beginning of the COVID-19 pandemic, one colleague and I decided to be COVID buddies. And what that means is that every day we check in with one another to see how we're doing. And guess what? Some days we're not doing so well, or other days we might be joyful, but I know that someone is reaching out to me and making that connection. We also have to recognize that physical distancing does not mean emotional distancing. We all know this, yet it takes intention and care, right, to be able to get creative with social connection, whether that's calling or texting, video chatting. It could be involving yourself in a support group, whether you've been there or not. Faith-based activities or joining a club. I know something I look forward to every week is a Friday happy hour with my parents. We each get some pizza and just enjoy an hour together chatting over Zoom. Finally, we can also think about connection more broadly, connection with ancestral roots as well as our community. And we all define community in different ways, right? So we can draw on the strength and resilience of our ancestors as well as collective humanity to promote healing and wellness. So what do I mean by this? One strategy is reclaiming ancestral stories of survival and triumph. And so by that, I mean that recognizing and really sort of learning more about the methods of survival of our ancestors, forms of healing, their strategies for resistance to oppression or oppressive policies or people, and also thinking through alternative ways of thinking outside that sort of Eurocentric lens. This might also be reading stories or poetry from those you find hopeful or meaningful, listening to spoken words or lyrics that speak to survival and triumph. This could also be sharing your own story through storytelling. It could be a blog or music, whatever venue seems most comfortable to you. Connecting with ancestral roots can also occur through nurturing your own cultural roots. This might be by connecting with an elder and asking them to share stories of what it was like when they were growing up and how they overcame oppression. And it can also be finding someone you really trust and care about to discuss difficult social issues or personal issues. So it might be discussing how racism impacts you. It might be discussing how misogyny impacts you or patriarchy, or homophobia. And so really finding people you connect with and who can value your perspective and validate your perspective. And then finally, uniting with similar communities to find commonalities. And what I mean by that is really beginning to take collective action to create change through participation in social justice groups, right? With what Angela was talking about, if we're starting to feel hopeless, how do we sort of increase hope? And we think about sort of optimism in the future and reaching out to those who are engaging in that difficult action-oriented work can be one way to increase our feelings of wellness and healing.
I want to acknowledge this approach to wellness that we've covered today. Thank you for sticking with us, and I hope you got something from this talk. We have different pictures here to represent individual wellness, interpersonal wellness between people, and then also organizational wellness. And that's kind of a teaser because we're going to be focusing on more organizational wellness for our next talk that we're going to share with you all. Big caution here. So an exclusive focus on coping strategies for individuals without acknowledging the organization's role, really looking at organizational wellness, implies that individuals experiencing burnout, compassion fatigue, or STS, that they're the ones at fault. What we want to look at is this resiliency building model, individual efforts, and within a systemic approach, within an organizational approach, within our agencies, allows for this resiliency building model. We can do self-care all day long, but if we work in an agency that maybe doesn't have the healthiest practices, that's really hard to maintain and can lead to even more burnout, compassion fatigue, secondary traumatic stress. We need both. And we're going to be talking about the second one more in our next talk. We have a website. So thanks to our team, our wonderful team, we have a website, the Trauma Informed Communities Project. All of you are welcome to join it. It is going to be the hub for our news, to highlight communities, to be able to really focus on our work. One of the things that I want to draw your attention to is this resources section here. You'll see it in the green, the resources section. Our team spent some time really sifting through all of the resources that have come out in the past. Has it been 7 months? But we really sifted through and broke it up by different service systems. So mental health, medical, child welfare, schools, other, really specifically on intersecting identity communities. And those can include LGBTQIA. We can look at rural areas. We can look at racially diverse communities and have resources for them as well. It's a hub of resources that we tried to organize in such a way that will be really digestible, because we can definitely have resource fatigue. I felt it where there's times that I didn't even know where to look. So this is a place that you can go and look at based on your service system. There's places for parents too. Go take a look and see what's there and see if you can use it. And here is our reference list from today. It's a lot. So take a screenshot, use it as you will. Go dive into some of these resources. I think they're really useful. Again, we so appreciate you all watching this, this talk, and really want your feedback as well. Again, we're all honored to be a part of your communities, and thank you for allowing us to be a part of your incredible work.